I officially, with no objection, launch Kampala International University Health Club. And I'm handing over the constitution to the president with your executive.
As part of an ongoing UNDP program, health awareness clubs have been created in universities to promote healthy living lifestyles among university students. On September 26, 2014, Kampala International University Health Club, with technical support from CEHURD and funding support from the UNDP Country office, launched a public awareness campaign on NCDs amidst students of Kampala International University.
The results of the study indicated that up to 67%, that's almost 70%. So if I counted 1, 2, 3, 4, 5, up to 10, and 7 of you would claim you have no idea what non-communicable diseases are. And yet, some of the risk factors or some of the elements that cause these diseases are things that you can do away with. Things like being inactive, things like smoking, or being in an environment where people are smoking, and doing something about that. We realize that many of you, the young people, you do not know what causes these diseases. And these diseases are lifestyle diseases. The way you lead your lives is how you end up making yourself sick in the long term. You will not smoke today and tomorrow you find out you have cancer. The effects will be shown after quite some time. The doctor will be speaking to us about some of these things, but really the background comes from this study.
During the launch, students were sensitized on the effects of smoking, inactive lifestyles, drugs and alcohol abuse on their health.
And when you see people who are taking all the consumption of shisha, they are at the age of 25 and below, 30s and below. So why are you killing your souls? Why are you killing your lives? What is there? What is in the shisha? Because you want to be a campus boy, you want to be a campus girl.
The non-communicable diseases are now #1 killer. Forget about HIV, forget about malaria. Non-communicable diseases kill many people than those diseases. I've mentioned the diabetes, I've mentioned the chronic respiratory diseases, including asthma. I've mentioned all those. Very dangerous. And tobacco can expose you to all those. Whether you smoke it, whether you chew it, because it has been observed that many of the cancer of the mouth, cancer of the throat, cancer of the intestines, cancer of the stomach is due to people who chew tobacco.
But what is the students' knowledge of NCDs like?
Okay, I knew about the diseases, but then I didn't know that they were non-communicable diseases. I knew cancer, diabetes, and I think of smoking, but I didn't know that they are categorized in that way.
I have been aware of some of the non-communicable diseases, but due to this sensitization, it has enabled me to get more information on how to care about our lives.
I've been aware about these non-communicable diseases, of course, but since I've seen specialists concerned about those non-communicable diseases, I've got some strategies, the crucial strategies that we can use in order to reduce those diseases or to just prevent some of them. Not here, but even in other places where we are coming from. Like in my area, because there are so many people are not aware about that. But since I've got some knowledge about it, now I can go back and then I also highlight something about that.
Before the launch of about the non-communicable diseases, we used to hear about these diseases, but we had not yet been told about their categorization or being classified as the non-communicable diseases.
Students also receive free screening services for breast and cervical cancer, hypertension, and other NCD-related services provided by the Cancer Institute, Heart Institute, and the Ugandan Non-Communicable Disease Alliance.
I've been here at distance. I came for services like to see my blood pressure, then to know my weight and my height.
My blood pressure, I have 127/68. Then my pulse at 77. My weight is 64, and then my height is 180.